Health Secretary Matt Hancock says it's a sober moment for the country. Well, joining us now is Richard Sloggett, who is a former special advisor to the Health Secretary and senior fellow at Policy Exchange's Health and Social Care Unit. Good morning to you, Richard. Good to have you with us this morning.
Good morning.
Let's just delve a little further then, shall we, into that update, particularly that Matt Hancock gave yesterday, because he also refused to apologise, didn't he, over the government's PPE record, as nurses were told they could refuse to treat COVID-19 patients if they didn't have it. Plenty of the papers today, along with Labour continuing to focus on that, along with the very slow progress being made too on testing. How do you think he's handling this ongoing crisis?
Well, I think one of the things I would say is this is a fairly unprecedented event, and it's a global event. And as a result of that, you've got real pressures on global supply chains. I think something like 700 million items of personal protective equipment have been made available across the NHS, and there have clearly been difficulties with distributing that equipment. And I think those are starting to happen now, and that is starting to work better. But I think one of the things that Matt said over the weekend, which has sort of been obviously seems to be quite controversial, is this concept of when PPE should be used and it should be treated as a precious resource. And I think he was asked a question specifically on whether there was enough PPE, and his answer was there is enough if it's used against the guidelines that have been developed. And those guidelines have been worked up with medical professionals and professional bodies. And I think what he was trying to basically say is that there is enough, but it needs to be used in the most appropriate way. And I think that's a balanced position, which is very sensible.
News too this morning, Richard, of an app possibly that could help to end the current lockdown involving contact tracing. Rather controversial, that, according to some reports. But for you as a former special advisor, how do you see any possible exit strategy to come from this government? What could it look like?
Well, I think it's clearly very, very difficult. And I think over the weekend, lots of people have started to look at this review, which you've alluded to, that's going to happen this week, to say, will restrictions be lifted? I think the government has always been clear that any restrictions will only be lifted if we reach the peak and have gone beyond the peak. And I don't think we're there yet. So I expect restrictions to stay in place for another 3 to 4 weeks before they're reviewed again. I think there's a number of different approaches you can take to moving the country out of this current situation of the lockdown. So 3 strategies sort of look the most possible. First is you could take a regional approach, so you could lift restrictions in particular regions. That creates quite some challenges around people then moving from one region to another potentially to escape the lockdown, as you saw in Italy. You can take an age-based strategy, so you can have the restrictions for younger people, for example, lifted earlier. Or the third one is you can start to lift restrictions for particular sectors of the economy and encourage certain bits of the economy back to work more quickly. I think this morning we're seeing some of that in Italy and Spain, where their lockdowns have been in place for a little bit longer. So in terms of an exit strategy, I don't see one in the next 3 to 4 weeks, but I think once we go to the next review window, there'll be heightened scrutiny around one of those 3 strategies and which one is most appropriate.
In the meantime, nearly 200 members of the armed forces, you'll know, now being loaned to NHS ambulance services during the pandemic. The MOD saying personnel is going to be sent to work at least at 5 trusts across the UK. Do you think, Richard, much more could have been done much earlier on in this crisis, to help our health service?
Well, I think one of the challenges we've had here is that we went into this crisis with acute workforce shortages across the NHS, and also not to forget social care as well, which is also severely impacted by this. I think what this crisis has highlighted is that we don't have enough healthcare workers across both of those two key sectors. And I think one of the learnings has to be that we need to make sure that we recruit and train enough staff in the future. I think on the armed forces specifically, I think they've done an absolutely brilliant job. And if you look at the hospitals that have been built in a matter of days, they played a key role in that. And coming back to the point on personal protective equipment, they have come in and helped on the distribution of that equipment across the NHS. And that kind of public service has been really, really valuable at this time.
And Just finally, Richard, of course, there's a huge focus too, isn't there, on the Prime Minister's discharge from hospital following his treatment for COVID-19. And it's pretty obvious now, isn't it? I mean, you can see it just in his video address of yesterday, how he looked. He was clearly far more sick than any of us could know or imagine.
I think that's right. I think his message last night was very, very powerful, and it obviously highlighted thanks to the whole NHS and those individuals in particular who helped him through what was clearly a very, very difficult period. He's now having a period of rest, which I think is very, very sensible. We'll follow the medical advice, and the Cabinet will continue to function in his absence, but I'm sure he'll be back to work within the next few days.
Richard, really appreciate your expertise and your time this morning. Thank you. Richard Sloggett there talking to us live, former Special Advisor to the Health Secretary, Matt Hancock, and also Senior Fellow at Policy Exchange's Health and Social Care Unit.